Good afternoon, and thank you all for being here. On behalf of the Community Foundation for Greater New Haven, I want to welcome our donors, community partners, nonprofit leaders, volunteers, advocates, community members, and friends. We're grateful for your presence and your commitment to the health and well-being of our region. I'm Karen DuBois-Walton, the President and CEO here at the Community Foundation for Greater New Haven. I will serve as the moderator for today's session. Before beginning, though, on December 15th, as we gather, I do want to pause and lift up thoughts in this moment as over the weekend, our broader community has experienced tremendous acts of violence that impact all of us in many different ways and continue to lift up for us the reasons why, as a community, we need to be together in spaces that allow us to heal together, to learn together, and to act together. We at the Community Foundation and our broader community send our thoughts and our prayers, and importantly, our desire for action to end this pandemic of gun violence that plagues far too many places in our communities. Today, we will turn our focus to the healthcare system in the Greater New Haven region. We are in a webinar mode. That means that you can see and hear us, but we cannot see or hear you. But we do want your interaction. We want to know what you're thinking, and we want to know what you want to know more about. So I do encourage you to use the question and answer feature at the bottom of the Zoom screen to submit your questions for today's panelists. We'll do our best to get to as many as we can. Today's session is being recorded. And if we are joined by any members of our press today, I want to stress that this session is off the record, and no comments heard today shall be used for any sort of media reporting. We will do our best to get to as many questions as we can, but anything that we don't cover will be included in our after session email. That email will go out to everybody who's registered, and along with the recording, will include answers to those questions and other useful information and resources. So with that being said, let's get started. Today's conversation, Shifting Policies and Local Realities, comes as a critical moment. Healthcare is being shaped simultaneously by national policy shifts, state-level decisions, and deeply local realities. While headlines often focus on Washington, D.C., the real impacts of policy changes are felt here, in clinics, in hospitals, in homes, and in communities across Greater New Haven. Our goal for our conversation today is threefold: to ground us in what the healthcare system in our region actually looks like, to understand the gaps and opportunities that existed even before recent federal changes, and to explore how all of us, philanthropy, community members, nonprofits, institutions, how all of us can respond together. I am honored to be joined today by three leaders who collectively represent the critical pillars of our regional healthcare system. Amanda Skinner, President and CEO of Planned Parenthood of Southern New England, will bring a regional lens on reproductive, sexual, and preventative healthcare. Paul Mounds, Vice President of Community, Corporate, and Government Relations at Yale New Haven Health, representing one of the largest healthcare systems in the state and a major provider of acute and specialty care. And Natasha Ray, the Executive Director of the New Haven Healthy Start, a trusted, community-rooted organization advancing maternal and infant health, particularly for Black and Brown families, hosted right here within the Community Foundation. So welcome to each of our panelists.
Thanks for having us.
Absolutely.
Morning, Karen. Hi. Or afternoon.
Good
I think it's afternoon now.
Good afternoon. Good afternoon. Thank you for being with us today. And while I did just a brief introduction, I'm going to start with asking each of you to introduce yourselves and your organizations and describe a bit of your role, but particularly what role your organization plays in healthcare within the Greater New Haven system. So this is our sort of level setting question. So Paul, why don't I start with you?
Yeah, well, good afternoon, everyone. Thanks for hosting us, Karen. My name is Paul Mounds Jr. I'm the Vice President of Community Corporate Government Relations for Yale New Haven Health, the largest health system in the state of Connecticut, as well as one of the largest employers in the state of Connecticut, based and headquartered here in New Haven, Connecticut. In terms of the level setting, in terms of what we provide all around healthcare, primary care, specialty care, emergency care, working alongside with our partners in the community from a federally qualified health center to ensure that there's a full overall aspect of support for the health and well-being of the individuals within New Haven and the New Haven region writ large. So happy to be here.
Thank you. And Amanda, let me bring you in. Tell us a bit about who you
Great.
are.
Thank you. Thank you, everybody. It's nice to be with you. My name is Amanda Skinner. I use she, her pronouns, and I'm the President and Chief Executive Officer at Planned Parenthood of Southern New England. Just a tiny bit about me. I'm a nurse and a nurse midwife by training. I spent 10 years in clinical practice in Waterbury, Connecticut, but did most of my training in New Haven. So I'm really, at my heart, I'm a frontline healthcare provider. At Planned Parenthood of Southern New England, we provide care to over 50,000 Connecticut residents every year in 14 health centers across the state. We are the only independent freestanding provider of abortion services in New Haven, nearly the only independent freestanding provider of abortion services across the state. There's one other, and they have a site north of Hartford. We're the leading provider of preventive sexual and reproductive health care services, as well as the leading sexual and reproductive health educator in the state. Our promise is to provide care no matter what. To tell you a little bit about us and what that means for us is that we provide care to everybody who needs us, regardless of their ability to pay. And I know we'll be talking about this today. That care promise is something that's really a threat for us right now. So it's really a privilege to be here with you all and have the opportunity to talk about that a little bit.
Thank you, Amanda. And Natasha, let me bring you in. Please introduce yourself. Tell us a
Thank,
little bit more about New Haven Healthy Start.
thank you. Absolutely. So, Natasha Ray, Executive Director for New Haven Healthy Start. My introduction to New Haven Healthy Start, I think it was eight weeks postpartum, and I just delivered my son who was 3 pounds, 14 ounces. So I volunteered for about 3 or 4 years, brought on as staff. I have held every position that the initiative has. So I come with a range of perspective in this work from experience in low birth weight myself to engage with the community to working with systems to strengthen our maternal and child health landscape.
Thank you. Thank you all. And I hope for our participants out there, you can get a sense of the wealth of talent, breadth of experience that is joining us today as we explore what's going on in healthcare in the greater New Haven region. And I think that grounding is also important because it helps to illustrate that healthcare is not a single system, but it is really an ecosystem. We could easily begin this conversation by diving into the federal changes and what that's bringing to us. But I think it's important for us to understand the state of our healthcare system well before the publicized recent federal changes that we will certainly get to. But in many ways, our community members in Greater New Haven have access to some of the highest quality healthcare services in the world. And yet, these services are being operated within a healthcare system that already had some pre-existing gaps, cracks, however you want to think about it, that meant that individuals could fall through, could not access at times. And so we want to start there actually with, put aside all of what's in the current news, and let's just talk about before the current wave of federal and state policy changes. What gaps or inequities already existed in our healthcare system here in Greater New Haven that you might want to lift up? So what were you concerned about that maybe wasn't working so well, and that you were sort of organized your work around? So let's start with Natasha in terms of what barriers did you see that led to the need for something like New Haven Healthy Start?
Absolutely. So I just want to say, so New Haven Healthy Start, it's a federally funded program designed with a community-driven approach to reducing infant and maternal mortalities and morbidities, which is the indicator of our country's overall health, right? And this year we actually received a D, we being the nation. We are one of 115 sites across the nation. We're the only one in Connecticut. And we are one of very few MCH programs, maternal and child health, that has a focus on fatherhood and paternal engagement. So, in addition to providing direct services through our amazing partners, since the late 1900s, we have been a systems strengthening program, and we also convene our community consortium where those who provide services and those who receive services come together and discuss and create action plans around access and barriers to healthcare and other social services. So since 1998, right along the time that the World Health Organization unveiled their social determinants of health report, Healthy Start has been addressing those issues. So what we're seeing now is just exacerbated issues that have been going on then, such as not being able to make prenatal care appointments due to lack of transportation, some chronic absenteeism with children because of chronic asthma, because of the environment, food insecurities. So all of the things that we're addressing now, we have been addressing since, again, the late 1900s. So while some individuals thought that, like, the pandemic created all of this, we have been doing this work 2 decades prior to the pandemic, right? And, there's a deep concern what these changes will do. It's like, for instance, when we first received the Healthy Start Award, the infant mortality rate in New Haven was 20%, meaning for every 1,000 births, 20 infants would not make it to their first birthday. Right now, that rate is at 5.7, right? Which is amazing, right? And Healthy Start did not do that single-handedly, but we have been strengthening the system and we have been championing this work. We have been helping and birthing individuals get into care. We have been supporting their partners. It's all about the healthy, we're taking a holistic approach to healthy birth outcomes, right? So that's some of, we're seeing the same thing is the short answer, right?
No,
And
thank you,
again,
right? Because
yeah, that's right. And the systems have been fragmented and working in isolation, right? So if families were involved with the Department of Children and Family and they may have missed an appointment, they're penalized, right? Instead of those entities talking with each other and coordinating that care, right? Offering transportation, offering conference calls and things like that, recognizing the barriers that individuals had to accessing care.
yeah. So thank you, Natasha, because you're lifting up, right? We are a state that prides ourselves often on being number one or two in things, in a country that prides itself on being, in the top 10 on things. And here you're lifting up an indicator when compared to other countries, that we are coming up a D on how we think about caring for infant and maternal health, and that preexisted any changes that are happening. And so I want to leave you there because we're going to get into the changes, and you're going to help us understand why it's so challenging to see some of what we see happening. But let's shift a bit to the work, Amanda, that you're doing. Certainly, you are sitting within a system that has been challenged. Consistently has been challenged, has been fought for to even be a system, a part of the system of care. So tell us about some of the challenges which you were facing, even in a state like Connecticut, around reproductive justice issues.
Again, thank you, Karen and Natasha. Everything you said resonated so strongly with me. I just want to, honor all that you brought into the conversation. At Planned Parenthood, we think of ourselves as a sexual and reproductive health organization that does our work with a reproductive justice lens. To do your work with a reproductive justice lens, what that means is that we have to strive to not only provide the healthcare services, but we have to address in ways that we can, either internally or through our external facing work, whether that's education or advocacy for policy and partnership, and sort of co-conspiratory behavior with ally organizations in the community. Really address those systems that make it challenging for people to live their healthiest lives, to access the care and services they need. And in a previous life before coming to Planned Parenthood, between being a midwife and coming here, I spent 6 years at Yale New Haven working on population health management issues, where again, you're sort of identifying, unearthing, and turning over all of these rocks. For us, what does that mean? That means things like 82% of our patients live at or below 250% of the federal poverty level. They may struggle to have transportation. They may need support. So internally in systems within the organization, we have care navigators. We provide transportation vouchers. We try to think about office hours that make it accessible for our patients to get to us. I mentioned we have 14 health centers across the state. That means we have physical presence in community with people so that they can get to us when they need us. Now, at the same time, even before this current administration, there were some real challenges that do have to do with policy. Substantive attacks on reproductive freedom, whether those are direct assaults like the overturn of Roe versus Wade, which occurred in 2022. Policies that have been targeting the trans community that make it challenging for our transgender and non-binary patients to access care, and even indirect underfunding of programs that support food, housing, or other things that our patients and communities need. And then very specific to Planned Parenthood, one of the ongoing challenges that we have had right here in Connecticut is that 40% of our patients are part of the Husky program in Connecticut, so they're on Medicaid. And in Connecticut, we, Planned Parenthood, are on a unique fee schedule, unique to us. We are nearly the only provider on this fee schedule, different from private OBGYNs, different from hospital-based clinics, different than other community health providers. Now, on the positive side, Medicaid in Connecticut does pay for abortion services, but on the negative side, our reimbursement rates for those services have been frozen for nearly 2 decades. It'll be 18 years in 2026 since our reimbursement rates have been adjusted at all. And that is obviously unsustainable. And then in addition to that, our preventive and primary care and primary sexual and reproductive health care services, our rates remain hopelessly out of date. They were adjusted a few years ago after being frozen for 15 years, but even then they were adjusted to 90% of a nearly decade out of date fee schedule. Across all payers and all services at PPSNE, reimbursement for services only covers 51% of the cost of delivering those services to our patients. That means 49 cents on the dollar of cost is what we lose. And we have pulled all of the levers that are available to us within our organization. But as a community-based primary care provider, there aren't a lot of levers to pull. And this is really not a sustainable situation. And I think, in a state like Connecticut, people might not be fully aware of those kinds of circumstances for a community-based healthcare provider.
Absolutely. Thank you, Amanda, for lifting up what you were facing prior to the changes we're all reading about. And Paul, I want to now bring it to you, right, as the voice of largest healthcare system in our state. The problems that Natasha and Amanda have lifted up land in the EDs of Yale New Haven Health, in the services that you're providing. Tell us what challenges you were experiencing prior to the current changes, and how the hospital was responding.
Yeah, first and foremost, we're a 24/7 operation. And so when you take into account when you're a 24/7 operation, just the overall aspect of the cost of doing business in the state plays a point into it. So I'll go into the reimbursement conversation. Before that, I would just say this. Over the past year, our utility costs went up 10%. That we have to take into account in overall in our budget. So that means that's 10% that is not represented of funding that can go back to the community providing care and such. So we have those type of issues in terms of the overall cost of doing business. So now when you go into the health aspect of the work, to follow up on what Amanda, my good friend, said, 68% of our payer mix is governmental. With that said, 55 cents on the dollar, we are reimbursed for Medicaid. So that means that we are taking up the additional part of the cost for not getting the full rightful reimbursement for the comprehensive care and health services that we provide, ranging from our children at the Children's Hospital all the way up to those who are in their older years in life in which we're providing overall services. In addition to that, you take into account the fact of what, as you said, Karen, the role of the emergency room. The emergency room has turned into primary care, unfortunately, with the lack of and the need to increase of primary care physicians within the greater region of not just in Connecticut, but in New England as a whole. What we are also seeing is those who are not covered or not able to be covered because of federal rules and regulations, or the lack of further expansion of coverage through state means. We are seeing our charity care, which is part of our mission, grow at a rate that is becoming unsustainable. And that's why we are so focused on ensuring that we have as many people who are able to be covered with comprehensive health insurance and health care, but also working to ensure that there's the rightful reimbursement alongside with it. And I know we're going to talk about the aspects of what OB3, the One Big Beautiful Bill, played and will play
Yeah.
going forward. But in terms of setting that framework, you have the overall cost of doing business in the state of Connecticut as a 24/7 comprehensive academic nonprofit healthcare system. And then on top of it, of us working with our community partners and being a comprehensive community-based provider as well.
Thank you. So, Natasha, Amanda, and Paul, you've all lifted up the confluence of the factors that are increasing community need, and challenging your ability to get compensated for the incredible work that you did, that existed and has been the framework. And Natasha's lifted up the start of Healthy Start being in the late 90s, right? This has existed for decades. And you have navigated creatively through that. And then I want to bring us into what the challenges of the day are, right? And so certainly our audience, our participants have been reading about, listening to, following a whole host of impacts that the changes at the federal level are having around how we think about care, how we think about compensation for care, what's funded, who's eligible to be covered. And so I really want each of you to be able to lift up sort of what are you seeing in terms of the federal and state policy, both changes and responses that are having the most immediate and tangible impacts on healthcare delivery here in the greater New Haven region. And so I'll let each of you speak, but Amanda, certainly if you could lift up how that is connecting to the work you're doing around reproductive health. Paul, if you could continue to lift up what the impact that's having for a provider like Yale New Haven and what that means for our entire community to have those challenges. And Natasha, if you could help us understand how this is impacting maternal health and infant health on the ground. So Paul, I'm going to start at the hospital system level and ask you to talk what's changed and how has that impacted the hospital?
Let's talk about coverage. First and foremost, OB3 is a systematic, unfortunate attack on the role of the federal government in covering individual lives to ensure they have health care in so many ways. So we see that through that process of the reconciliation that they needed to create savings, and they created savings by going directly at the healthcare and health system related structures. In Connecticut alone, there is a potential between 11 to 22% of the current Husky enrollees to lose their Medicaid coverage over the next 10 years. This was a state that saw their uninsured population cut in half because of the expansion of Medicaid through Husky D. But what you're also now seeing because of the One Big Beautiful Bill is that by including work requirements and other administrative aspects to it, it is actually going to make it a factor of people not having coverage. And for an entity like ours, when they need that support and help, we're not going to turn them down, but we're not going to be able to actually be duly supported to be able to provide that support. And so it further is going to exacerbate the issues that we have talked about in terms of reimbursement. And I know that's the same that Amanda is dealing with, and then Natasha is going to be dealing with it with her population that she serves in a different way. In addition, what we're also seeing is right now there's the conversation about the marketplace tax credits. Marketplace tax credits allowed for the increased coverage and lower premiums of individuals who are through the marketplace exchange in the state of Connecticut that's called Access Health CT. Without those marketplace tax credits extended, which they expire in the end of the month, about 30 to 35% of the individual lives that are covered in the marketplace of Access Health CT, about 150,000 individual will lose their subsidies, which means that their premiums will be at a rate that is not sustainable in this day and age of inflationary forces and also life forces. We did hear that the governor, through a fund that was created by the legislature, will look to cover a portion of that. And I want to be key about that. It's a portion. The state is taking a temporary role to cover a portion. That still means that providers like Planned Parenthood, providers like Yale New Haven Health, providers like Fairhaven, providers like Cornell Scott Hill are going to have to take up the slack on that. So what we are seeing is a pushing down of these forces of lack of coverage, leading to, which won't lead to a lack of care. I want to be careful about that. It's not going to lead to a lack of care by providers such as Yale New Haven Health and others. It just means that we are going to be forced to look at other ways to manage the budgetary forces so we can provide what is core to our mission, vision, and values. So at the core, I would say at the end, health providers such as ourselves are seeing a direct attack on our mission, vision, and values to ensure that we have a healthy, broader community writ large through policies that are coming from the federal level being forced to be addressed on the state level, but really the answers are being looked at from the provider level.
So thank you, Paul. Right, you've helped to make a very clear connection between why a federal tax bill that provided a series of tax cuts is having such an impact on the healthcare system. Right, that the way to pay for these tax cuts the choice was made to have that come out of coverage for members in our community, and you've brought those numbers home for us very clearly. And so, Amanda, that lands on your front steps as well.
Sure does.
And so I want to bring you in to lift up certainly, and I'm going to start using OB3 because that's catchy. It's a better way of saying it. But so you've talked about how that's impacting. I want to talk with you, Amanda, about how that's impacting you. But then you have some additional challenges that are uniquely yours as related to reproductive health and justice. So please, what's changed for you?
Yeah. So thank you, Karen, and thank you, Paul, for setting me up so well. I might start using OB3 too. We use HR1, or we say something much less flattering. And so OB3 is so pleasant comparatively. So I think I'll start there. But as you said, Karen, there's more, and I could probably keep you all here all day, but I'm going to try not to. The very specific thing that was in the One Big Beautiful Bill is a very specific, targeted attack on Planned Parenthood. There is a provision in that bill that defines what's called a prohibited entity. And a prohibited entity means that this entity is prohibited from receiving federal Medicaid dollars. And that prohibited entity definition, the parameters of it are that you have to be an essential community provider, which means you primarily serve people of low incomes and provide services that are difficult to access. You have to primarily be a sexual and reproductive health care provider. You need to be an organization that provides abortion services beyond the Hyde Amendment provisions, which is a federal government amendment that prevents federal dollars from being used to pay for abortion services, except in truly life-saving circumstances, according to their definition. And then you need to have received more than $800,000 in Medicaid reimbursements in federal FY23. And there is almost only one organization in the entire country that this provision applies to, and that is Planned Parenthood. There are one or two other organizations that are independent abortion providers in, I believe, Maine. Other than that, the only organization in the country that this provision applies to are the Planned Parenthood affiliates around the country, including Planned Parenthood of Southern New England. On a practical level, what that means for us, because this provision went into effect on July 4th, is that since July 4th, with only a brief exception when there was an injunction in place, we have been unable to bill for preventive Medicaid services for the patients that we see. And for Planned Parenthood of Southern New England, that amounts to about $12 million a year in reimbursements, which is almost 25% of our total revenue. Our preventive services as a percent of our patient services revenue from Medicaid only is about 38%. And so we have been unable to be reimbursed for those services, with the exception of this one brief period where there was a preliminary injunction in place. There are 2 lawsuits regarding this, but at the moment, neither of those lawsuits are in a position where they have allowed us to be reimbursed for those services. So of course, because we provide care no matter what, we are seeing the patients, we are not turning anybody away based on their ability to pay, but we are not getting paid for those services. And this is a very specific attack on Planned Parenthood. And very specifically, the impact is greatest in Planned Parenthoods in states like Connecticut, where abortion is legal and where Medicaid may cover abortion services, but even where it doesn't, because those states are states where Planned Parenthoods often participate extensively in the Medicaid plan, where the states have done Medicaid expansion, enabling more patients and people to be able to access Medicaid for coverage. And again, that means that the Planned Parenthood and other community-based healthcare providers and hospitals have a higher percentage of patients that are on Medicaid as opposed to being just completely uninsured. So the most significant impact is being felt at affiliates like ours, as opposed to affiliates in states where abortion has banned and the Planned Parenthoods had already been sort of exited from the state Medicaid plan, or the state Medicaid plan was so limited as a proportion of their services. The harm here is that in addition to attacking our ability to provide preventive services, the impact could be a substantial reduction in access to abortion care in those communities that are standing in the breach as we see abortion bans be enacted in red states and in on lack of access states across the country. We had also already lost our Title X funding. The Title X program is the nation's family planning program. This was a widely bipartisan supported program. Everything we're talking about here are public health interventions. Public health interventions are good for the community. They're good for the economy. They're good for education. They're good for healthy, thriving communities. Title X was one of them. It allowed us to provide preventive family planning services, STI tests, annual exams, cancer screenings, for low or no cost on a sliding fee scale to people who were uninsured or underinsured, based on their income level. We lost that funding starting on April 1st of 2025. For us, that was another $1.9 million a year. And again, that funding has just been withheld from us with no end in sight to whether or not that funding would ever be restored. Our expectation is that that funding will not be restored. As Paul talked about the impact of people losing their healthcare coverage in the state, we know that impact will come to Planned Parenthood as well, because when patients lose other places to turn to for healthcare, they turn to their community-based providers that they know won't turn them away. So we expect that we will be seeing even more un- and underinsured patients as well. As I said, I could really keep going on the sort of current administration attacks on Planned Parenthood, but those are the two that I think I'll highlight the most. Is the Medicaid defunding and the loss of Title X.
Yeah, no, no, thank you. And it is unfortunate that there is a longer list that you could keep going, but thank you for lifting up those key. Natasha, I want to pull you in because the moms and babies that you're serving and supporting are feeling all of what Paul and Amanda just talked about in terms of being able to access care and continue their insurance coverage and navigate a system. But I also want to lift up that you are working under a federally funded grant program that has also had to navigate the vagaries of new administration, new Secretary of Health and Human Services, and with new priorities. You've had to navigate a government shutdown and questions about the continuation of your grant. So I want you to have an opportunity to lift up also, again, highlighting what's already been lifted or unique challenges that New Haven Healthy Start is facing. And
Absolutely.
I should say, Natasha, I failed to mention in your introduction that in addition to running the local New Haven Healthy Start, you are also president of the nationwide network of Healthy Starts, and so you bring that vantage point as well. So please, Natasha.
Absolutely. Thank you, Karen. And so, yeah, to Amanda and Paul's point, OB3 is weakening affordability, stability, and access to care. We're facing expiring ACA subsidies and new Medicaid requirements, and safety net providers and public health systems are under growing strain, all things we heard. But in terms of local impact indicators, and I just wanted to call back the infant mortality rates, because while those have dropped significantly, so there are less babies dying. However, there are more babies who are being born very sick, right? So, and those are preterm birth rates, right? When an infant does not go, birthing person does not go full term, and for whatever reason, that infant is born extremely early, very early. So Connecticut statewide, the preterm birth rate is 9.3, but for Black birthing people, that number is 13.7, right? And the research Connecticut read the research, listened, participated in the research, and with that came up with the maternity bundle payment program that was launched in January of 2025 as part of a major shift of how Medicaid pays for maternity care. So instead of like the traditional fee for service, care during and up to 90 days postpartum is paid for as an episode-based bundle with quality and equity built into the model, again, to address those preterm rates. The bundle included support such as doula services, lactation counseling, patient navigators to improve outcomes and address these disparities. And the success of this bundle, of course, depends on continuous coverage through pregnancy and postpartum. Um, so if families lose or churn out of Husky due to the federal work requirements, which is part of the new Medicaid requirements, they may drop out of the bundled care pathway. And so that's what's happening. There's going to be a more frequent need to be redetermined for Husky insurance if we're able to hang on to that. Um, so it's again, families are going to be navigating a lot, and Healthy Start is here to, we're here to support that. We have patient navigators at the Yale New Haven Health System. We have a care coordinator at Fairhaven Community Health Center. We have community health workers at Community Action Agency that will help our participants navigate the changing landscape of Medicaid. But to your earlier point about the challenges that we've been facing federally, so this year, leadership in the House eliminated FY 2026 funding for Healthy Start. In addition to the administration, like laid off the entire division of Healthy Start and perinatal services, effectively like eliminating that staff that administers this program, all 115 of us. However, following the government shutdown, the division and its staff were reinstated, and that's only until January 31st. So currently, the government is operating on a short-term funding bill that will expire at the end of January. And the National Healthy Start Association and individuals in the maternal and health field were working to ensure that Healthy Start is funded when Congress negotiates the FY 2026 spending bill. And we're fortunate to have Congresswoman Rosa DeLauro in a key position on the House Committee on Appropriations. She has been a stalwart champion of Healthy Start and is involved in negotiations regarding critical funding decisions. Both the Congresswoman and her staff have a close relationship with New Haven Healthy Start. Senator Murphy also, who is a member of the Senate Committee on Appropriations in the Senate Health, Education, Labor, and Pensions Committee, is a key supporter of Healthy Start. Both committees have jurisdiction over the Healthy Start program. In the immediate future, the association will be meeting with his staff to educate them on the importance of Healthy Start to Connecticut. And we would welcome others to carry the message about Healthy Start to Senator Murphy as well.
Natasha, you're leading us. Thank you, because you're leading us exactly into where I want us to go next. And so, thank you for that overview of it is just mind-boggling to both hold the information you gave us about how successful your partnership has been side by side with the assault on the funding, and certainly want to take us to one of the things that I value about this group of people that represent this spirit in this community. Is that this is not going to be a webinar where we just talk about what is being done to us in this moment. This is really an opportunity for us to talk about how each of these partners have raised their voices, the voices of their organizations, and rallied community to create different in this moment, to push back, to challenge, to create new. And so we want to bring some of that energy into the conversation, lest I leave everybody in this valley of despair. There is plenty to worry about, but there's also plenty that you're doing in the face of that. And so, Natasha, I'm going to stay with you because you just started talking about some of your congressional the organizing you've been doing to get Congress and Senate attention on this. And I'll pull you, again for your national focus on this. Tell us how you've been responding and how the system of Healthy Starts have been responding to these challenges.
Absolutely. So nationwide, we have signed on to larger letters with maternal and child health organizations such as AmChip, such as City Match, March of Dimes. We've done that nationally. Also, individual Healthy Start sites have sparked letter writing campaigns. They have done visits to their legislators, and whether that be on the Hill or locally when our legislators are home. Actually, the association have members on the Hill, some members on the Hill now, who are conducting Hill visits before they leave for holiday. I know for us in Connecticut, we generated about 6,000 letters to the entire Appropriations Committee because we know we have the support of Congresswoman DeLauro. So we wanted the entire committee to have those. Our partners participated, our families participated in those letters. So alone from Connecticut, there were about 6,000 letters that went out.
Thank you.
And we have invited Congresswoman's Rosa DeLaura's staff to our community consortium meeting, and she has come to us to talk to us about ways we can continue this fight and how to navigate things that are going on. So that's been helpful as well.
Absolutely. You're modeling what it looks like to engage a broad set of voices in advocacy, policy advocacy work that goes side by side with the essential services that are being delivered. Planned Parenthood, a national leader in the combination of quality healthcare delivery and that policy and advocacy work. So Amanda, how are you responding in this moment?
Thanks, Karen. And yeah, I mean, I think, if you're on this call, you realize that exists within a system. People exist within a system, and we can't live those full, healthy lives. We can't advance health equity without addressing the systems as well. And you address systems through lobbying and advocacy for policy change that enables, structures so that people can live healthier lives, whether it's transportation or paid time off or paid family leave or whichever, sort of thing particularly calls to you. So the truth is that right now we are bridging ourselves through this moment. We are drawing on our own reserves to be able to continue to live up to that promise of care no matter what. And as an organization, as I have said several times, that's not a sustainable approach for us. That can only last a very short period of time. So like Natasha said, we are organizing and lobbying to encourage our states to step in, and, in this case, to encourage the state of Connecticut to step in. And some folks have mentioned, I know Paul mentioned that the state allocated $500 million to address funding gaps that resulted from federal defunding of programs. So when you all are thinking about what you can do here for Planned Parenthood's patients, because really that's who this comes down to, is the people who are counting on us, is you can call your local elected officials, you can call Governor Lamont's office, you can write them letters to tell them that you care about Planned Parenthood patients, that you know that we've been defunded from the Medicaid family planning dollars, which is where the federal dollars sit. And for our services, that's 90% of the dollars. And that you want the state to stand up for its values in this moment and to offset the loss to Planned Parenthood. That's one of the most important things you can do for us. Of course, we are turning to our donors to support us in this critical moment. And I feel like it's been 8.5 years that I've been at Planned Parenthood. And every one of those years, things have gotten more challenging because of things like the pre-existing problems with frozen reimbursement rates that you can't out-strategize. But that means that every year we've been saying to our donors, we need you now more than ever, but we need you now more than ever, because we are literally drawing down our own reserves to be able to meet this moment. And while that is what reserves for, it is a limited pool of money and not going to last us very long. The last thing that I always want people to do is to storytell about Planned Parenthood. How did Planned Parenthood play a role in your life? What difference did it make for you or for someone that you love? One of the reasons that we are a target for this administration is because Planned Parenthood is popular and powerful, and most people have a story of self about how Planned Parenthood changed their life. 1 in 4 women in the United States has received care at Planned Parenthood. 1 in 10 men has received care at Planned Parenthood. Everybody knows and loves somebody who has had an abortion. So our work impacts all of your lives, and yet it is convenient and easy to stigmatize us. And at times, as a movement, the reproductive rights movement has participated in that stigmatization, not purposefully, but unintentionally, by trying to sort of overemphasize more, sort of what they thought were more popular services and underemphasize abortion services. And I think it's really important that right now we tell our stories proudly. We talk about why Planned Parenthood matters. We disrupt the stigmatization of abortion. Abortion is a healthcare service. And the truth is, Planned Parenthood and individual decision-making about these critical life decisions is wildly popular. Depending on the poll that you look at, between 70 and 85% of people in the United States, if asked who should be making these decisions, they would say, no politician is more qualified than I am, along with my healthcare provider, to make these decisions for myself. And where we see the bans being enacted, we are seeing scores of people coming out who are then impacted by those bans for things that they hadn't contemplated. Miscarriages, ectopic pregnancies, assisted reproductive technology. Their lives are being impacted in ways they hadn't imagined they would be by these bans, because in fact, no politician can fully contemplate all of the circumstances and is more qualified to make these decisions than you are. But the way we turn the tide on this is, instead of hiding or being quiet about it. It's by talking about it. It's by talking about why this matters to us. So that is my other call to action for all of you. If you feel comfortable telling your story publicly, if you want to submit a story anonymously to our website, you can. But also when you call your elected officials, if you can share why it matters to you, that's even better because people need to hear the individual personal impact.
Absolutely. Thank you. Thank you, Amanda. Paul, I'm going to bring to you also ways in which the hospital system is, digging into reserves, we've heard, raising its voice, we've heard,
Mhm.
storytelling, we've
Mhm.
heard, disrupting stigma, we've heard, right? All of things that are helpful in this moment of pushing back. And I want you to have an opportunity to talk about what your role at the hospital has been leading.
Yeah, no, I would say this. It echoes everything that Natasha and Amanda have already stated. But I would also say this when it comes to advocacy. Advocacy starts with education on the issue. Like these forums that we're having allows us to actually educate a greater public and interested parties about these issues. So that's one of the things that I've been raising with us as the hospital is taking our issues outside of the borders of our hospital and bringing it into the community. And we're doing that in various different ways. Earlier this year, when we're advocating on Medicaid, instead of us just doing an outreach to members of our hospital community who are also community members, I want to also say that, is also with our community-based partners, partnering with Andy Orifiche and on part of my team to actually provide a link for them to allow their voices to be heard on this issue of Medicaid and what it means to them. So that means we're utilizing our resources and our technology on a like-minded issue to allow the community another way to advocate and an easier way to advocate. So that's one aspect. The other aspect that I would say is it's data and information. And I want to give kudos to Darcy. I think Darcy's on the line listening in, and everyone on the community impact and health equity team at Yale New Haven Health who just finalized the community health needs assessment, which is just loaded with so much data and information about the health issues that are facing our communities from not just direct health outcomes, but also issues of housing and issues of food insecurity and mental health. That's within that data, and that data helps all of our other partners to be able to tell their stories on the issues that are important that they're advocating on. And so we will be making sure that we get that information out in a way that is easily usable, understandable, and applied to help them be able to advocate on their various issues. And then I will also just say for us is going back to the fact of members of our greater 40,000 strong Yale New Haven team providing the amazing health services, not only in this region, but writ large, giving them an opportunity to better advocate as well. Just this past weekend, we launched an advocacy campaign for our nursing community on the issue of not considering them as professionals when it comes to graduate-based education. And that will have a large effect on the economic mobility of individuals. It has a large effect on workforce placement and the overall aspect of providing health services within our system and to our community. And within that one weekend, I can already say from New York to Rhode Island, and of course, Connecticut, already close to 300 letters have been sent to legislators from those three states to say, we need you to stand up on this issue. And that was because we decided to change the advocacy aspect, where it's not only speaking from the institutional voice, but also raising issues that's important to our workforce, that is also important to us, but putting it in a manner and the voice of them. And they, for the first time, we utilize an aspect of having them tell their personal story. And the stories that we have received have been amazing. And there are stories to actually empower our workforce to say, we want to do more, we want to advocate more, and we want to stand up for more. And so those are the ways that we are looking to change it and really be involved on advocacy. And then the last part that I would say is we have an aspect that we say on our team of we not just want to provide the fish, we want to provide the fishing pole. And the fishing pole that we want to provide is How do you advocate? What are the processes and systems of advocacy? How does government actually work? What are the frameworks of advocacy? Who are the right people to talk to at the time of an issue? So we did a test launch earlier this year. Natasha's already challenged me to say we need to do more, and we're going to launch our Advocacy 101 series that will allow for members of our community, no matter who they are, to learn about advocacy directly. Because
Absolutely.
their issues are our issues. We're all one community. All of us are here. We might be talking from different vantage points, but we're all talking about one greater thing, the overall health and well-being of our community. And it's so many different issues that cover that.
Thank you. As always, I have far more content than we can cover in 60 minutes, so we're moving quickly. I'm going to try to pull in a couple of questions from our audience as well, and maybe I'll just have one person respond to question. But whether it is loss of Medicaid coverage due to eligibility changes, or it is the unaffordability of healthcare as the subsidies are lost, or it's our communities that have never been able to be insured. So, what plans, Paul? Maybe I'll kick this to you. What plans are underway that hospital or more broadly, to ensure that healthcare for the uninsured, undocumented, uninsured it remains available in our
Well,
Greater New Haven community?
I would say, let's say on the undocumented based community, we provide up to a certain age in the state of Connecticut in terms of that coverage. In the first part of the reconciliation bill was trying to attack states for doing that. That has been protected against. However, we are seeing a growth in the need for coverage on that area. So I would say if that's an area of concern, that direct outreach to your legislators is important right now. Amanda also talked about the fund that has been created as part of, and I call it a stopgap fund, because now that has to be built into a greater focus and mission and vision of the state of Connecticut to say this needs to be a part of our full budget. But those funds are available and are now being advocated for. And so you're seeing organizations like Planned Parenthood, you're seeing the Hospital Association of Connecticut, you're seeing the nonprofit community, you're seeing those who advocate on SNAP and TANF, that the federal attacks on those various issues that are having a state effect is really advocating for the state to really step in. I think it's important that, as someone who used to be on the other side of those decisions when I was a chief of staff or a governor, it is important for that advocacy now, but it's also important to tell those legislators and executive officials, use the funds for as you described it to be used for. This is not a time for earmark determination and earmark funding, because there are real crises that are happening in our communities. So I would say that is an
Absolutely.
important aspect overall to get across. But in terms of the other part, and this goes into the education aspect, we need more members of our community to be part of the processes of raising their voice of advocacy on these issues, because there are so many important issues that are being raised at the state capitol. But the first and foremost, I always say to people, advocacy is a 24/7 sport. And the best way to advocate is to your legislators when they are home. And they're home now. So this is the time to advocate and let them know what are the issues that are important in the stories that you have, and tell it.
Absolutely. Thank you. Thank you. There is so much to cover. There are myths about Medicaid and the Affordable Care Act, and who's covered and who's not, and information that we will continue to share out, responses to those that we weren't able to get to. I want to end. I think one of the most powerful ways that we continue to feel agency and even a sense of hope in these moments is to be left with something that we can do. So I'm going to leave each of you 30 seconds to put a call out to the community about something that they can do, starting with Natasha. Something that might bring us hope, because we could take some action to support moms and babies in the greater New Haven area. What's something people could do?
Absolutely. Thank you so much. So the bottom line is that federal decisions are being made far away, but their impact is deeply local, right? And our role is to protect families, reduce harm, and hold the system together while we advocate for policies that promote health equity. So We need to reduce harm by assisting families navigate these new requirements. We need to stabilize care by supporting community health workers, doulas, and care coordination. We need to meet basic needs such as food, transportation, and other essentials, and advocate locally. Data plus lived experience will drive action. Donate to support the efforts of New Haven Healthy Start, and reach out to Senator Murphy.
Thank you. Amanda, what can people do?
What can people do? Let's see. Somebody asked about how other organizations can get knowledgeable and aware about this. So I think one of the things you can do is if you're involved with another not-for-profit in the community or any other book club, I don't care, invite us. We'll come talk to literally anybody, anytime about the work that we're doing. To restate what Paul said, definitely hold your elected officials accountable. Call them and tell them to put their money where their mouth is. And particularly right now, your local elected officials right here in the state. The third thing is, try to pay attention. It's really easy in a moment like this to despair and to lose hope and to stop wanting to focus. And one of my favorite quotes, I'm going to give you two before I go. They're both from Mariam Kaba, who is an activist. The first is that hope is a discipline. You have to keep practicing it. You cannot let up. You cannot allow yourself to lose hope. And in fact, it is a privilege to lose hope. People who are trying to do harm are not going to get tired. They're going to keep doing it. That means we need to keep doing it too. So hope is a discipline. Please keep practicing your hope. And the last one is let this radicalize you rather than lead you to despair. So practice your hope and let this radicalize you rather than leading you to despair.
Thank you. Paul, last thing.
Well, I would say, lastly, first and foremost, thank you for having us. And I would say this, we can't reach the summit by ourselves. Organizations, individuals, this community have to work together and have to partner together to raise a larger aspect of our voices to get the actions that we seek. I will also say this, also understand you're not in this alone. This is a time for us to pool our mindset, pool our resources, utilize the technology that we do have and see how we can work together with it. But more importantly, we need to pool our stories. We have to pool our stories, and we need to pool together to ensure that we reach the summit that we're seeking. These are some tough times that we're all seeking institutionally, organizationally, and personally. But we're not in it alone. And that's the lasting message I want to leave.
Thank you. Thank you. Thank you. Three amazing speakers today. I want to thank you, each of our panelists, for your leadership, your honesty, your commitment to this community. What we've heard today is clear. Healthcare is not just shaped by policy, it's shaped by people, by partnerships, and sustained investment. Even in these uncertain times, it is local actions that matter. Philanthropy matters, advocacy matters, and our relationships across systems matter. Here at the Foundation, we're committed to supporting organizations and leaders who are advancing health equity and protecting access to care for all who call this region home. Thank you for being a part of this conversation, and more importantly, for being a part of the solution. Thank you all for joining us. We'll see you next time.